It is 2 a.m. Your child has a spiking fever, and you are walking through the unpaved streets of your neighborhood, calculating your next move. In a medical emergency, having your monthly health premiums deducted from your paycheck means very little if you walk up to the wrong hospital reception desk. The right to healthcare only works if you understand the administrative gates guarding it. To access the Social Health Authority, or SHA, you have to treat the healthcare system like a highly structured public transit network. There are designated local stations to board at, mandatory transfer tickets, and specialized terminus stops. By the end of this video, you will have a clear map of this route. You will know exactly what documents to carry, which door to open first, and how to defend your wallet when a receptionist tells you the digital system is down. Mastering this sequence is the only guaranteed way to secure cashless medical care and shield your household from sudden out-of-pocket debt. Step 1 of any non-emergency medical event begins locally. You must start your journey at a Level 2 dispensary or a Level 3 health center. These local facilities draw from the primary healthcare fund. They operate on a strict capitation model, providing preventive and curative services with zero out-of-pocket fees for registered members. This chart shows the healthcare tiers, from Level 1 community providers to Level 6 referral hospitals. You must start at Level 2 or 3 to enter the network. Skipping the line to go directly to Level 6 means the system automatically rejects your visit. The SHA payment engine requires an electronic trail starting at the primary level. Bypassing these local stations to seek higher-tier care triggers an immediate automatic denial of coverage by the system. When you arrive at the local clinic's reception desk, you must present 2 items, your national ID and your physical mobile phone. Before leaving your house, your registration status must be active and verified. Confirm this anytime by dialing the USSD code *147#. Stage 1 verifies your eligibility and paid-up status, while Stage 2 triggers a one-time password. This password is sent via SMS directly to your phone. You must read this code back to the receptionist immediately to proceed. This digital handshake enables the walk-in, walk-out protocol. Your final claim will show a zero total amount, meaning the government settles the bill directly. Without that mobile device, the authentication sequence cannot be completed. If you leave the phone at home or cannot access the SMS code, the hospital is technically unable to open your digital file for covered services. If your local doctor determines your condition requires advanced care, they will generate a physical referral letter. This letter is your mandatory transfer ticket required to legally access the next tier, Level 4, 5, or 6 hospitals. At these higher tiers, the financing shifts. Your care is now drawn from the Social Health Insurance Fund, which reimburses the hospital based on standardized tariffs. For specialized interventions like major surgery or a chronic disease admission, the hospital must submit a digital pre-authorization request before they touch a scalpel. By law, the SHA Claims Management Office has exactly 72 hours to review this request and change your status from queued to approved. Attempting to force a specialized admission without the proper referral chain or a confirmed pre-authorization guarantees an automatic rejection by the SHA algorithms. Because the system is heavily digitized, it is vulnerable to IT failures. Server downtimes and portal crashes have frequently left active members stranded at reception desks. If a clerk tells you the portal is down and asks for a cash deposit, your first step is to politely remind them of their contract. By participating in SHA, they signed a binding tariff agreement with the government. Next, make a specific procedural demand. Instruct the facility to initiate the manual claim submission process. If the hospital refuses the manual process and aggressively demands out-of-pocket payment, escalate the issue. Dial the SHA Help Desk at 0800-720-601 or email helpdesk@dha.go.ke. A crashed portal is a technical dispute between the hospital and the government. Knowing your right to a manual claim ensures you do not personally absorb the financial penalty for an IT failure. A successful cashless hospital visit relies on 3 distinct actions: boarding the system at your local Level 2 or 3 clinic, clearing the SMS checkpoint with your registered phone, and securing a documented referral for advanced care. This procedural map acts as a shield against a bureaucratic and technically rigid medical landscape. But even when you follow the route perfectly, manual reviews and strict algorithms can still result in a denied claim. In Episode 7, we will decode the exact anatomy of a rejected SHA claim and show you the legal levers you can pull to